Good afternoon, everyone. Today we are going to learn about sarcoidosis. Actually, it's an important topic in MBBS because the differential diagnosis of many diseases is sarcoidosis. So, to have a clear-cut idea, so that we can differentiate it and diagnose on time. So, what do you mean by sarcoidosis? It is a multi-system granulomatous disorder of unknown etiology. It's a multi-system granulomatous disease of unknown etiology that is characterized by presence of non-caseating granulomas. So, sarcoidosis involves many systems. That is more than one systems. We will learn it later on. Etiology, as we have described or as we have said it in definition, it is of unknown etiology. So the first point is unknown. Basically, the cause behind is unknown till now, but there are some factors that are linked with sarcoidosis, like it is linked with atypical mycobacterium, different viruses infection. Then there are some evidence of family clustering and genetic factor, that is familial history. Then it appears less commonly in smokers, as smoking is associated with many diseases, but in case of sarcoidosis, it appears less commonly in smokers. Now we'll go for pathology. Mediastinal and superficial lymph nodes, lungs, liver, spleen, skin, eyes, thyroid gland, and phalangeal bones are commonly affected, but all the tissues can be involved. So as we have said, it is a multi-system disorder. There are some organs that are affected by sarcoidosis, but any organ can be involved. In about 90% cases, it affects lungs, but it can involve any organ. The characteristic histological feature of sarcoidosis is non-caseating epithelioid granuloma. Then fibrosis is seen in about 20% cases of pulmonary sarcoidosis. There is disturbance in the calcium metabolism that leads to increased formation of calcitriol, that is 1,25 dihydroxy vitamin D3 by alveolar macrophage, and may lead to hypercalciuria, calcinemia, and rarely nephrocalcinosis. So here we have learned that the characteristic lesion that is the histological feature is non-caseating epithelioid granuloma. And as we have known that over 90% of cases it affects the lungs, then fibrosis is seen in 20% of the cases of pulmonary sarcoidosis. And there is also the disturbance in the metabolism, which cause increased formation of calcitriol by alveolar macrophage, and that lead to hypercalciuria, that is calcium in the urine, hypercalcinemia, that is calcium in the blood above normal, and there is also nephrocalcinosis. And there is, I've given a short introduction about the Lofgren syndrome. What do you mean by Lofgren syndrome? It is an acute illness characterized by erythema nodosum, peripheral arthropathy, uveitis, bilateral hilar lymphadenopathy, BHL, lethargy, and occasionally fever. It is often seen in young women. So these symptoms, if seen in young women, it is known as Lofgren syndrome. The symptoms we will discuss in clinical features. So now we will go for clinical feature. First of all, it may be asymptomatic, that is abnormal routine chest X-ray or abnormal liver function test. In this, patients are normal, that is he has no complaints about any symptoms, but when he comes for a routine checkup or for any other checkups for the other abnormality, there we find there is abnormal chest X-ray or abnormal liver function test, but the patient is asymptomatic. Then there may be respiratory and constitutional symptoms, erythema nodosum, arthalgia, ocular symptoms, skin sarcoid, including lupus purniae, superficial lymphadenopathy, There may be hypercalcemia, diabetes insipidus, cranial nerve palsy, cardiac arrhythmias, and nephrocalcinosis. So there will be problem like respiratory and constitutional problems, erythema nodosum, arthalgia, ocular symptoms, skin sarcoid, that is including lupus neo, superficial lymphadenopathy, hypercalcemia, diabetes insipidus, cranial nerve palsy, cardiac arrhythmias, and nephrocalcinosis. Here I have taken a picture or a photo from Davidson. Here we can see that ocular changes like lacrimal gland enlargement, anterior uveitis, Zika syndrome, and there is also parotid gland enlargement. There may be pachymeningitis, space occupying lesion, that diabetes insipidus, lymphadenopathy, bilateral hilar lymphadenopathy, BHL, cardiac arrhythmias, heart block, sudden death, cranial nerve palsy, interstitial lung disease, granulomatoous liver disease, phalangeal bone cyst, splenomegaly, hypercalcinosis, hypercalciuria, renal stones, skin plaque and nodules, infiltration of scars, arthropathies, osteoporosis, mononeurotic multiplex peripheral neuropathy, erythema nodosum, arthropathies, osteoporosis, and there is a nasal cutaneous sarcoid lesion, lupus pernicion here. You can see in the image. So from the image you can easily remember the points or the clinical features. Actually the clinical features depends upon the organ which has been involved by the sarcoidosis, and according to that you can tell the clinical features. And now we will go for the investigation. Before that we will Now we'll go for the investigations. Before that, I want to say you a little about chest X-ray changes in sarcoidosis. Then we'll go for other investigations. It is a bit very important. It gives us a very important information. So the chest X-ray changes in the sarcoidosis. There are stage 1, stage 2, stage 3, and stage 4. So in first stage is stage 1, BHL, usually symmetrical, paratracheal nodes often enlarged. That is often asymptomatic. These patients in the stage 1 often asymptomatic but may be associated with erythema nodosum and arthalgia. The majority of the cases resolve spontaneously within 1 year. That means they are usually asymptomatic in stage 1, but there may be erythema nodosum and arthalgia, and the patient recovers spontaneously within 1 year. In stage 2, there is BHL and parenchymal infiltrates. In this case, the patient present with breathlessness or cough, and in this stage 2 also they resolve spontaneously. In stage 3, there is parenchymal infiltration without BHL. In this case, the patient cannot resolve spontaneously, so treatment maybe needed. Treatment is needed. And in stage 4, there is pulmonary fibrosis. There is progression to ventilatory failure, pulmonary hypertension, and cold pneumonia. BHL means bilateral lymphadenopathy. So these are the chest X-ray changes in sarcoidosis. Now we can go for investigations. As it is a multi-system organ failure, or it is multi-system, it affects the multi-system. Their investigation is according to that. Also we can do CBC. There in CBC there may be lymphopenia, that is